who will expand further on that particular path between how do scientists and commercial interests come together, and whether entrepreneurship by scientists can unlock any potential in our sector. Thanks, Rajesh.
Thank you, Anurag, for Gagandeep for this wonderful session. I think we had some really interesting thoughts, and it's clear that the healthcare is the most sensitive matter of life, actually, and obviously we have to walk the path that is actually increasingly harder and becoming increasingly challenging of how to be able to take through this. You also must have got a good flavor to think about it, that if you want to solve problems in India, you need to do it by understanding diseases as well as solutions within the country, and therefore how do we proceed ahead. One of my possible solutions is actually to be able to come up with interesting models that really entrepreneurships is what they bring to in different forms of the world. This is just to emphasize the fact that, if you look at the burden of diseases in the world, it's increasing, it's not decreasing everywhere. Whatever you look at, whatever we call, you need to take care of early or you need to take care of late. It's always going to be more and more. And clearly, all of these, India is one of the hub of almost all the disease that you can think of, actually, that you want to come up and talk about it. So the question is really, we are 154th among 195 countries in the global burden of diseases. And then the challenge is, how do we really solve our own problems? Or can we at all try to solve these problems in some way moving ahead? And how do we proceed? If you look at population to doctor ratio, actually, and I got this interesting article that I was reading about, it says WHO mandates about 1 in 10,000 per population, actually. In India, probably have reached about 10 lakh doctors in modern medicine, and 10,000 every year actually doctors are produced by Unani, Ayurveda and Siddha, and therefore the Minister of State and Health in fact informed the NCI that India has almost reached the ratio that is really required to look at it, actually. The question, if you will ask yourself, is how true is it in the real world? Do we really have enough doctors to be able to carry out this work, and aren't we still hub of diseases? It's all for you to really take a call on it. The healthcare, if you look at, as you would realize, is one of the largest and one of the most complex sector actually in terms of any entrepreneurship problems if you look at. It's really one of the most complex if you want to start solving it. It's also moves very, very slowly. I mean, you can't bring anything particularly to the market very fast. It's one of the most slow moving. Anything to bring to the market is really enormous amount of problems and challenges, as already talked about. Despite this, it's about 1/5 of the GDP in USA comes from healthcare related industries actually. So clearly it's a very, very large market that one wants to look at if one wants to start solving it. The real challenge in diverse area of industries, which activities ranging from manufacturing to facilities management actually. So we talked about new drugs, vaccine treatments and methods which involve R&D and manufacturing at one side, while you have medical equipments and devices which are routine products and high-tech equipments that you require. Then you have managed healthcare, which are to do with healthcare policies and insurances and how to handle. And then there are operationalized processes like hospitals, clinics, labs, physiotherapies, nursing homes actually. So you can see it's a very, very vast portfolio if one wants to look at healthcare as a real opportunity aspect to look at and how to be able to manage this actually. Rather interestingly, the healthcare has some unique problems for business models that almost no other industry in fact faces actually. And this is one, and which is obviously very, very critical as we've heard. Government intervention in healthcare market and activities is pervasive actually. On one side, you want them to be there because it's really about human lives, and that's the one that counts. So you really want government to be participatory, but you want to understand how much it should be part of the system. The demands for healthcare services are highly priced inelastic actually. This is not a wonderful model for business models to look at because you can throw away prices and bring down the systems. That's not what you can do. The consumers and producers face inherent uncertainties regarding needs, outcomes and cost of services as technology keeps moving. And there are two immense challenges of asymmetric information. which is really that what you know and what the patient knows, a very, very large difference between them actually. So you really need to solve those issues. And then there is a principal agent problem, which are ubiquitous, which is actually means that, there's always somebody in the middle with whom you have to connect to the next door person to be able to solve these kind of issues. Then there are barriers to entry to exist because of professional licensing, regulation, intellectual property protection, specialized expertise, research and development costs, and obviously the natural economies of scales that also becomes difficult in the system. And finally, the transaction cost in both provision of care and the coordination of care is very, very large. And in fact, that's what makes the whole industry very, very afraid of trying to put in money and try to go ahead with it because of all these problems that look at. These are very unique to the healthcare sector that one needs to start worrying about actually. And the last problem, as rightly pointed out by Professor Reddy, is that is healthcare a right or a business actually, that one constantly debates about it. Whether it's really business models, that's the one that needs to work, or one needs to actually say this is the right to be healthy in life and therefore one will look at it. But with all these problems, I always say, this is Warren Buffett that says predicting rain doesn't count, building art does actually. And obviously what he's talking about is favorite market. He says telling us about market problems, it is as important as how we can act on them clearly. So the challenge really is how to really start solving them, how to really start taking them ahead and be able to take one at a time to be able to make some sense out of it. Unfortunately, the entrepreneurship that's considered to be the exciting era of world as of today is really filled with enormously challenging attributes that they actually look for people to have. I mean, starting from curiosity to time management, strategic thinking, efficiency, resilience, sales, finance, networking, and they all look for that you should have one person who has all of it in you, such that you can then become an entrepreneur and be able to carry out these stuff actually. Of course, this is impossible for any single individual to do, so you team up, but when you team up in small teams and they have their own inherent challenges in looking at it actually. In fact, the reason why US and Israel has leaderships in these areas is because they have a tremendously strong medical research and development in cooperation with higher education system and the technology industry willing to participate and be able to continuously move ahead. And you would realize in healthcare almost everything comes to here, this was done there. There's very little what was done here and what one can do actually. And I think that's where I'm trying to propose that entrepreneurship is the only model that probably provides us a method to do it. In fact, India did this long time back, and I don't know how many of you are aware of that, but really the scientific entrepreneurship scheme was floated by the Department of Scientific and Industrial Research in 2009, which is more than a decade back that this office memorandum was issued actually. Adopted by CSIR in no later than that, in about 6 months' time, adopted by the governing body, and in fact permitted scientists to start and float their companies and be able to take up this opportunity to move ahead with this actually. And this is almost 10 years of it. Of course, we still think it's still very, very different. But what has happened? In fact, we have almost missed this. I think very few people, in fact, has taken up to that, and we are almost a decade behind. And the only thing we do is keep finding faults and say why we can't move ahead, why we have to go back, why we didn't do this properly, and what all kind of things. But I think the biggest problem that I realized in this country over the years that I have now been about 2 decades is the really from policy to action. There is almost no efforts put in. There are tremendous amount of policy decisions, there's wonderful policy papers, there are very little action plans that are ever put in place that provides a framework for you to proceed ahead and therefore follow certain guidelines. And I think Dr. Gopalakrishnan yesterday beautifully summed this up in his lecture of talking about what is really the critical part. The good policies are important, but they are not sufficient. They must be put into the practice, and you need to have a framework that requires action planning, removal of implementation barriers, to monitoring and accountability as well actually. And I think this is almost never done in our country. In fact, a rather interesting file that you can actually fetch from USAID Health Policy Initiative is how do we maximize benefit? And it's really got to do with this fact of how policy to action is the supermodel of what American systems is able to manage to be able to look at, to be able to do. And they talked about how sustained capacity at individual, institutional and systems level are generated, how efficient and equitable and sustainable mobilization and allocation of resources are critical, how the linkages between policy and health system and strengthening initiative with clear indicators of impact, and finally the leadership, governance and accountability, how do you put in practice? And it's a really bulky volume that it's rather interesting to look into and see how the policy and the action needs to be the key to what one can look at. I can just give you what are the problems that we are facing if one has to do this entrepreneurship in this country right now. And I think some of the IITs and ISCs have done better, but almost all the MOST institutions are actually struggling to work with it. It's almost non-existent, you can say. There's almost not even a... Really, the problem is large and the problem is very, very hard to really undermine because it's not very easy to look at it. I mean, one needs to set up Section 8 companies that can hold equity of the scientists. If you are working in a parent organization, you need to find a mechanism to manage financial portfolios and patents. You need to understand who will handle it. You need to find a mode of engagement of scientists in a company in terms of their time distribution. What's the amount of salary structure they look at? How do you manage conflict of interest? There need to be a complete detailed documentation of it because all scientific entrepreneurship can be only in the area of their scientific expertise. And there's very rarely that you will ever be able to distinguish and discriminate this. How does the utilize government funded resources for enterprise, actually all the several institutions, and then how to determine company valuations and when should organize exit from it actually. Because it's not very easy to keep maintaining these portfolios for very long periods of time. And I think all of these are almost absent in this country wherever you go. There are some IITs and some ISCs have some papers and some documents which are much better, but it's still a big challenge actually. It's really, I can share with you some of the problems that face. For example, where do you set up, in which incubators, what are the compliances of the incubators? Does incubators in fact have a pollution control available done there, because biological research is obviously full of pollution control? Or can you give the addresses of these incubators as a place for your companies to start? Or is it really a challenge that you have to put some other name to look at? Starting from place to people, which is an ever-changing requirements. Who will fund, why, and what is the exit policies actually? What are the scientific plan and the overlaid financial requirements in terms of business policies and business models that are looking at? And really, finally, how the idea and innovation can actually come together to really be able to carry out actually. And I think these are kind of rather interesting problems, because if we start solving these problems, there are immense opportunities and there are immense younger people who are willing to take risk and in fact come on the board to be able to start looking at it. I think some of this policy and the action plan in fact can be put together. In last couple of minutes, maybe I wanted to share a couple of examples of how the problems was, but maybe I just skip them for the matter of time. But just take an example of, for example, the diagnostic market in this country right now, if you look at it. It's about 30,000 crore total diagnostic market. Radiology accounts for about 48%, pathology about 48%, and then molecular oncology and diagnostic is about 6%, which is to do with innovation and lab developed tests. If you really want to see how this market is growing, it's supposed to be growing at about 27.5% every 5 years. So clearly a tremendous opportunity to look at. But can you actually make difference by making diagnostics in this country and then be able to start using it? But the only thing we'll do is we'll keep borrowing diagnostics from abroad and then start using it in our own model systems. Just give you an example of my friend who was doing PhD with me along with the Institute of Science Bangalore, who had this energy and enthusiasm to start this company called OncoStem in Bangalore. And she founded this company in 2011, and her first product was launched in 2016, and it's still not a revenue-making company. So you can imagine, almost close to a decade, the company has no profit making. It does make revenue, but doesn't make any profit. It's really got to do with what they have developed called can-assist breast biomarkers. These are developed on Indian patients so that you can do histocompare IHC stainings and then do morphometric analysis and use machine learning statistical algorithm to predict the risk scores. And these risk scores for the breast cancers can be developed into low risk and high risk, which allows you to probably predict whether you should go ahead with the chemotherapy or you should not go ahead with this chemotherapy at all or not. And you would imagine that this is extremely important, because you don't have really a way of identifying this, even though this is a statistical way of doing it. But at the end of the day, this does provide a person an opportunity to go back and ask a question, should I go ahead with it, should I not go ahead with it, which is actually done on the several data. If you look at the problems, even though we say there are a large number of patients, in 30 cities, they have only been able to test this out as of today in India. In India, only 550 patients. And you can imagine an enormous challenge. We will all say there are a large number of diseases, but it's almost impossible to be able to work through the processes and systems to be able to reach and be able to carry out the systems. This is another example of another student of mine who started working on this disease for a PhD, and in fact started this company called Immune Biosciences in NCL Innovation Park in Pune, along with Dr. Natarajan. And she took her challenge is to develop a new chemical entity, discover and develop, and take it from lab to the market. Again, a very challenging problem. Almost no drugs in India have come from as an NCA have been developed, and how to be able to carry out the process. The last couple of slides, if I take 2 minutes, actually the area of support for entrepreneurs. What is the biggest challenge? A lot of people in the IT industry have got tremendous amount of benefit out of it, of what government policies has mattered. For example, if you look at BIG and SIBRI, in fact have provided support to entrepreneurship in an amazing way. They all get this wonderful 50 lakh grant if you apply to BIG, and then you get. But once the funds are taken from venture capitals and have shell companies outside, the DBT and BIRAC doesn't allow funds to come into the government model. If you look at if IT industry ever had to work like this, the IT industry would have never flourished. Everybody has a center elsewhere in the world where they support. In fact, if you take money from a venture capitalist in India, and if you bring what you call foreign direct investment into the country, and you're paying taxes, you're bringing out patents, you're putting India on the map, in fact, rather than being penalized, these entrepreneurs should be supported. And I think it's very important that these kind of systems are put in place in our country for biotech industry really to move ahead. Otherwise, this FDI is continuously going to be a challenge. The other thing is that we need to put up national level repositories which will archive samples and work and start UPS to build technologies and various stuffs. The DBT has started the Sahaj portal, which is very decent for national services. However, if you look at CSR labs and IITs have been provided this on chargeable basis. But if you really go back and read the fine print, the purchase procedures of every single of them are wrongly built in actually if you want to carry out this process. And it's an amazing problem. And if you don't solve these problems, there are some people who will actually be solving the problems actually for others. And this is the real challenge. The cycle time that it takes to execute studies in hospitals must reduce from months, and therefore you can see the government hospitals should be incentivized to work and be able to carry out. And finally, the regulatory framework has to be transparent and have to be updated regularly with times, because that's what is demand of it actually. I think I'll stop here and just say yes, entrepreneurship is probably one of the wonderful models because you need small people, small teams, very agile systems, and it can in fact dig the hidden potential that is really important to alleviate poverty and alleviate a variety of problems that this country is facing. Thank you very much. We'll stop here.